Good morning. Welcome to the University of San Francisco School of Nursing and Health Professions. My name is Dr. Maggie Baker. I'm the Dean of this wonderful school, and welcome to Conversations with the Dean. As you might be able to see behind me, it's a rainy morning here in San Francisco, but it's always a good time to be here. So today I have the distinct pleasure of having with me Professor Andrew Nguyen, and he is the program director for our Master of Science in Health Informatics, as well as an educator and a researcher here at the University of San Francisco. So before I let him get a word in edgewise, I just wanted to tell you that the current focus of Dr. Nguyen's research is using informatics to fundamentally change how patients or clients interact with the healthcare system. And I'm just going to read this off, Professor Nguyen, because I have to. A description of your research is that by combining semantic computing, artificial intelligence, and machine learning, you're giving patients or clients a voice and empowering them to better manage health conditions. So glad you gave me that to read, because I wouldn't have been able to tell that. And then in your spare time, which I'm sure you have, not very much of, you enjoy hiking, rock climbing, scuba diving, and you're the director of operations for the San Mateo County Search and Rescue Team. And I want to just not only thank all the search and rescue teams and all the first responders that we have in our communities on a daily basis, because we never know what's going to happen and when, but your team also was deployed several times to the campfire in Paradise, and you as the director of operations had a major role in that. So I just, as a member of our community here in this school and at the university, I just really want to extend our thanks to you and your team for everything you did during that time.
Thank you.
So we're glad you're here today, and can you describe a little bit about our Master of Science in Health Informatics program?
Yeah, so our Master's of Science in Health Informatics program is a pretty diverse program. We're targeting essentially the intersection between computers and healthcare in a very broad sense, but that means a lot of things, right? And so it ranges everything from the deployment of electronic health records that we're seeing a lot of right now, to just moving data around and getting it from one place to the next in a way that we preserve all the context and information of it. But it also involves analyzing the data, kind of leveraging the data. And so as our program is primarily focused on all of it's getting digitized. And so how do we essentially leverage it? What can we do with all of the data that's now in servers, computers, kind of in the cloud, what have you? And how do we get that data out? How do we process that data, kind of manage it, and then do something useful with it? So whether it's clinical decision support, population health, whatever that may be, just ultimately to improve the health and well-being of people, and kind of facilitating the healthcare system and making it run faster, better.
Great. So let me guess, when you were a little person, you grew up thinking someday I want to be a health informaticist, right?
So, as my mom likes to tell me, that I always had this interest in computers and medicine. And, as far as I can remember, at least, I definitely had some interest between doing something with computers, right, tinkering with them and just playing around with them, trying to teach myself how to program. And then as I kind of, went through education and went to my undergrad, really was focused on computer science and just enjoying a lot of that. I had an internship early on in biology, decided that I didn't really want to pursue biology, even though I was also very interested in medicine. And so I kind of saw it as an interesting path towards med school, and kind of just going down that path. But in doing so, got a couple internships in informatics and started to work with radiology specifically, and kind of moving data around and being able to link up to CT machines, CT scanners, MRIs, and whatnot. And through that process, really saw the potential behind just taking computation and working with all of the stuff that's starting to get digitized and leveraging that for medicine. The interesting thing about kind of health informatics is very few of us knew we wanted to do it. We all fell into it somehow. So if you kind of go to the American Medical Informatics Association, for example, pretty much we all say we fell into it somehow. We were interested in something, so whether we were physicians, nurses, pharmacists, and then had some interest in computing and kind of got into it that way, or we came from the technology side of things but really wanted to see what we could do in healthcare, and we all kind of fell into it. And so we're definitely at that turning point now where having a lot of programs come up either at the doctoral level, master's, even the bachelor's level. We're starting to bring awareness down to the high school level even, so that people know this is a potential career path and a really unique way to bring together computer science, healthcare, medicine, and statistics, mathematics, and whatnot.
Great. So you're trying to keep, some people will fall into it in the future, many will, but you're trying to actually have this be something that younger people think about as a career path for themselves.
Yeah, I mean, it's still something that people are going to fall into, but just even working with a couple high school students, for example, last year, it was really interesting to me because as I was working with them, it became clear that this was something that was very interesting to them. And yet before interacting with them, they had no idea this existed. Mm-hmm. And so I hope now that as they go through their undergraduate careers, they're able to just kind of keep in the back of their mind that there is a really interesting path here. So even if I'm studying neuroscience, there may be a way to link that back because, you know, they enjoyed programming, they enjoyed the idea of analyzing data and kind of working with it at that level.
Yeah. So there's just, having been a nurse for a long time, there's just mass amounts of data produced every single day, including in what people are wearing, their wearables at this point. I mean, there are mass amounts of data. Tell us a little bit about the importance of health informatics and the impact that it can have on people's health and on the healthcare system.
Yeah, I mean, I think the interesting thing behind the practice of healthcare, right, at all levels of healthcare, is essentially we're taking data and we're at some level converting that to information. Now, whether that was through clinical research or just research in general, and then from there, you know, interacting with the patient, getting a sense of what's really going on, and then using kind of all of this combined to make a decision of some sort. And what's changing is kind of you mentioned is the amount of data coming off of a person is becoming more than what any one human can handle and process effectively. So whether you're a nurse or a physician or a pharmacist, you know, or any other healthcare professional, it's becoming really hard to synthesize all of that together in an effective way. And so that's where computing, I think, becomes very critical. We don't want to replace the human aspect because healthcare and just caring for another person is both subjective, but there's empathy and there's other aspects involved that you really do need a human connection. But at the same time, how do we go through, you know, gigabytes or terabytes of data that are available, you know, both about the population that you're similar to as a patient, but also you and the data that you're generating. And so I think that's where computing and health informatics in particular becomes a really critical part of this process, and just allowing us to work with the amount of information that just is continuing to grow every day.
So it's really about helping people make the right decisions regardless of who that is, and make those right decisions based on data, and then improve lives, improve quality of life, improve patient safety, improve a lot of things.
Yeah, I mean, I think a lot of it really is just coming down to how do we help everybody just improve their decision making overall.
Great. So we only have a couple of minutes left. Can you tell me briefly why you can't just take, for instance, information that's available in the high-tech sector in general or in retail or something and apply that to health informatics?
I mean, I think one of the big challenges, like we get compared all the time to other industries, right? And you start throwing around words like big data, machine learning, artificial intelligence, and we're seeing so much progress being made in other fields and other industries. And so, you know, I think that's a great question. Why is it so much harder in healthcare? And I think one of the big problems behind that is the data that we have is just, in my opinion, fundamentally dirtier. One, because if you look at a lot of industries, the collection of data came after the industry itself came after the introduction of computers. So, for example, like the current model of advertising, right? A lot of this comes from the fact that the internet's already there. We have all these systems connected. Healthcare has been around for a long time, well before computers were. And so now we're trying to fit computers into this workflow and how medicine and healthcare are practiced today. And because of that, we end up having just a lot of ways to say the same thing, a lot of things that may sound different, but essentially they're the same, right? Or the opposite, where you're saying something very similar, but you mean something totally different because you're coming at it from just a fundamentally different perspective. And so given all of that, it's really hard to understand all the nuances of the data unless you have a healthcare background. And so really being able to bring people in who have clinical backgrounds, healthcare administration backgrounds, but then also equipping them with the tools to analyze or work with that data, I think is kind of what we need to be seeing.
That sounds really important. So we're about to wrap up for today's conversation, but if you had any words of wisdom that you wanted to impart to our viewers, some of whom maybe are current students, some of whom maybe folks who are thinking about health informatics as a career possibility, do you have any words of wisdom for them?
Yeah, I mean, I think that the key thing is health informatics is such a broad and diverse field, and it means so many things that if you're really considering some career path or just looking into informatics, health informatics specifically even more, is to really understand that there's a bunch of different things that kind of make up health informatics, and to really dive in and focus a little bit. The best analogy I have is that if you become a nurse or a doctor, you don't just say, I'm a nurse, right? It's what kind of nurse are you? Are you in critical care? Are you pediatrics? And so there's a lot of specialties. I think that aspect carries over to health informatics also, where you may be focused on managing data, you might be focused on machine learning, you might be focused on integrating kind of all of this into the clinical workflow. And there's a lot of opportunities there.
Wonderful. So, Professor Nguyen, I really want to thank you for stopping by my office this morning, and it's been great having this conversation with you. Remember, we want to hear what your questions and comments are. We actually took comments from the last time and used that to improve what we did this time. We want to know what you're interested in, and as I sign off today, I want to wish you all a happy and healthy and safe day. Thank you.